What do IDC tumor grades 1, 2, 3 mean? Invasive ductal carcinoma is the most common type of breast cancer, and understanding its tumor grades can help you grasp how the disease might behave. These grades tell us how much the cancer cells look like normal breast cells and how quickly they might grow and spread. The grading system ranges from 1 to 3, with each level giving insight into the tumor's aggressiveness. When a tumor is graded as 1, it means the cancer cells look very similar to normal breast cells. These are called low-grade or well-differentiated tumors. They tend to grow slowly and are less likely to spread quickly. Because they resemble normal cells, they often form more organized gland-like structures under the microscope. This generally translates to a better outlook and may influence treatment options. A grade 2 tumor, known as intermediate or moderately differentiated, falls somewhere in between. The cancer cells show more abnormalities than grade 1 but are not as aggressive as grade 3. These tumors tend to grow at a moderate pace and have features that are less organized than low-grade tumors but not as chaotic as high-grade ones. They often requiring a balanced approach to treatment, considering their intermediate nature. Grade 3 tumors are the most aggressive. These high-grade or poorly differentiated cancers look very different from normal cells. They tend to grow rapidly and are more likely to spread to other parts of the body. Under the microscope, these tumors show fewer glandular structures, more variation in cell size and shape, and a higher number of dividing cells, which indicates quick growth. Because of their aggressive behavior, high-grade tumors often requiring more intensive treatment. The grading process involves examining 3 key features of the tumor cells. First is glandular or tubular differentiation, which looks at how much the tumor forms gland-like structures. Second is nuclear pleomorphism, which assesses how much the size and shape of the cell nuclei vary. Third is the mitotic count, or how many cells are actively dividing. Each feature is scored from 1 to 3, and the scores are added together to determine the overall grade. A total score of 3 to 5 indicates a low-grade tumor, 6 to 7 is intermediate, and 8 to 9 is high-grade. This grading system, often called the Nottingham or histologic grade, helps doctors predict how the tumor might behave and guides treatment decisions. Lower-grade tumors usually have a better prognosis and may respond differently to therapies compared to higher-grade tumors. It is important to remember that each person's cancer is unique, and treatment plans are tailored to individual cases. In summary, understanding the tumor grade in invasive ductal carcinoma helps paint a clearer picture of how the cancer may grow and spread. Grade 1 tumors tend to be less aggressive, while grade 3 tumors are more aggressive and likely to spread faster. Always consult with healthcare professionals for a comprehensive diagnosis and personalized treatment options. Remember, medical science continues to evolve, and your healthcare team is your best resource for understanding your specific situation.